Hi, I'm Adeola Ali. I'm a pharmacist, yes, a real one. And I also run an online pharmacy called OneHealth, where you can buy your medicines and get proper professional counseling. Because confusion around drugs, dosage, safety, and side effects are very real. I thought I heard it all until I started reading the questions we get every single week. Questions like, if I double my Viagra for a month, will everything stay permanently big? Can I break my paracetamol tablets into 4 for my baby? Or my personal favorite, do I have sleeping sickness or am I just really lazy getting out of bed? Don't worry, we hear you. This channel exists to debunk myths, correct misinformation, and bring clarity to how medicines actually work in real life, not Google life. Let's get into today's question. Hi, it's me again. So this is, I think, the second episode. I'll probably stop counting at some point and just record straight away. So I have another interesting question, but very common question that we get all the time. I remember even recording some answers to this maybe about 3 years ago. I'll embed it in the link somewhere. But it's around expiration date, and I think the question was, if my drug has just expired about a couple of weeks ago, is it still safe to use? It's a tricky one because obviously on the one hand you might need the drug immediately and you just want to use it, and 1 week, 2 weeks, what does that matter, right? However, they are very, very important, and sometimes I even misunderstood. So let's start with how we even interpret expiration dates. So on most medicines, you see the expiry dates written in different ways. So some of them will have like the month before the year. So what that means is if the month is before the year, it expires by the end of that month. So the last day of the month. Like others are written day, month, year, or month, year. Right? So some are written day, month, year, or month, year. So depending on the manufacturer and the country, right? So if your medicine says 06/2026, so you can consider that it's safe up until the very last day of 06, so up until the very last day of June, as long as you have stored it properly. So you have to check your storage conditions as well. You can't imagine that it still has the same potency and efficacy, meaning it still has the same strength, and it's going to be still effective to treat what you're supposed to treat if you store it inside some locker under the heat or something like that. It's not going to work. So however, up until the expiry date, the manufacturer guarantees that the medicine is safe and effective if stored properly. Once the medicines expire though, then it may lose strength, so potency, and it may lose efficacy, right? And also it might be unsafe completely. So when you think about tablets and capsules become less effective for a fact, right? But liquids like syrups, eye drops, insulin injections should not even be used at all once they expire. Like you don't want to even risk that at all, because it's not just going to might not be ineffective, might be actually fatally unsafe as well. So the short answer is once your medications expire, right? So if for example, it's expiring the next month, or you can use it up until the expiry date. So if you still have 1 or 2 weeks left and you've stored it safely, that's fine, but not beyond that. I would say this one last line now, right? If it has expired, if the expiry has passed, then so should your medicine. Shikana. Hope that clears it up. If today's question sounded like something you've wondered about or asked in your head, you're not alone. That's why Ask The OneHealth Pharmacist exists. You can submit your questions, buy your medicines, and get professional pharmacist counseling through OneHealth, or ask in the comment below. And remember, this is educational, not a replacement for seeing your doctor. See you next week, and keep the questions coming.